Lagos State is launching a major push to understand and combat HIV. To this end, the government has flagged off the Nigeria state-level Antiretroviral Therapy Impact Survey, the AIS. This massive household-based effort aims to measure HIV treatment, coverage, and virus suppression levels among adults aged 15 to 64 across all 20 local government areas. Running from October to December 2025, teams will visit over 6,150 randomly selected homes. Approximately 11,354 residents will be interviewed, tested confidentially, counsel, and get immediate results. Anyone who tests positive will be linked directly to care. Dr. Olusegun Ogboye is the Permanent Secretary, Ministry of Health, Lagos State. He speaks more on the survey.
The survey is a significant health initiative aimed at improving the well-being of the people of Lagos State. The Antiretroviral Impact Survey is designed to assess the effectiveness of the HIV and AIDS response in Lagos State. The data collected will help us understand three key outcomes. One, the number of people living with HIV who have been identified. How many of these identified are receiving life-saving antiretroviral treatment? And then thirdly, among those on treatment, how many have achieved viral suppression? Meaning the amount of HIV in their blood is so low that they cannot transmit the virus to others. It's important to note that the main goal of HIV treatment is to reduce the amount of virus in the body to such a level that it cannot be passed on to other people.
Dr. Ogboye stressed his findings will improve HIV care planning and outcomes.
The objective of the survey is in twofold: to measure population-based HIV treatment coverage, which involves assessing the proportion of individuals living with HIV who are receiving life-saving antiretroviral therapy, and to determine the prevalence of viral load suppression. This will help us understand the percentage of individuals on HIV treatment who have achieved viral load suppression. In short, the effectiveness of the therapy that we're giving, meaning HIV has been significantly reduced in their blood and the risk of HIV transmission is reduced and their own health outcomes are improved. The importance of the survey. This survey is critical for several reasons. Informing policy and planning. The data collected will provide valuable insights that will inform our health policies and strategies to enhance HIV testing, treatment, and care services in Lagos State.
Crucially, he emphasized visited homes are randomly chosen, not indicative of HIV status.
Mark every house that is visited by the enumerators and think that it means there's someone there with HIV. It is definitely not. They are randomly selecting 6,150 something households and they will visit those households.
He urged against any stigma. Officials hope the results will help them direct resources where they are most needed and improve the effectiveness of HIV prevention and treatment efforts.
It's a health intervention, but we know that without the general public, without the community participation and the active engagement of every one of us, we may not be able to achieve our goal. And that is why this press briefing is very critical. It is a critical step in the survey. So we appreciate the efforts that have been put in place so far by our partners and the cooperation we have received from the Lagos State government in our engagements in the kickstarting of this survey.
I think it's clear. The objectives of this study are very clear, and Lagos has a track record for excellence, so we are comfortable and we are confident that this will also be successful and the objectives that have been set will be achieved.
Also for you to know that even though this survey is associated with data collection, but the primary intent really is about generating evidence and information that will make the life and livelihoods of Lagosians and Nigerians at large better. So it doesn't, even though it starts with data, it doesn't end with data. It actually ends with making our lives better.
The goal: to gather vital data to strengthen the fight towards ending HIV as a public health threat by 2030. The message to Lagosians is, if a survey team visits your home, cooperate, knowing is a confidential, scientific step towards a healthier state for everyone. Love Oyedokun for Cable News 24.